For folks considering leaving the city for the suburbs, here's something to consider. A new study out of the University of Chicago concludes that rates of depression are lower in big cities than they are in suburbs or small towns. This despite the problems that cities have faced, like crime and congestion. And joining us is one of the study's co-authors, Luis Betancourt, professor of ecology and evolution at the University of Chicago. Luis Betancourt, thank you so much for joining us.
My pleasure.
All right, so explain your findings for us, if you would.
So we assembled several sources of bigger data that allow us to characterize symptoms of depression in U.S. populations organized in different cities. And these are studies from the Centers for Disease Control, from National Administration of Mental Health, and also from social media. And so what we find is, somewhat surprisingly, is that rates of depression are smaller in larger cities. And they do so in a way that's consistent with the fact that in larger cities, people have more social contacts, larger social networks. And that is known to be protective against certain mental diseases, particularly depression. So what we find is essentially this effect that in larger cities, people may have other problems, but in regards to depression, their rates tend to be smaller. So there's less risk of depression.
So you're saying that the big factor here is socialization. People are in more crowded spaces. They're interacting with people more. Is this a main factor that causes depression, lack of this?
Yes, that's exactly what we think is going on. And that's what's characteristic of a city as a whole, which is for which we have data in this study. So the signature that we get is that essentially, if you live in a larger city, you tend to do more things with more people. A lot of these relationships are not, deep in terms of friends and family, but allow you to see different things, have more choice, have different points of view. And that is known to be protective against depression. And we put together facts that we had from previous studies that predict a certain form by which the number of people that you know increases with city size. Together with the fact that having more of those contacts leads to a smaller risk of depression, and we get the effect that we measure.
And you mentioned
exactly that. Having more people. Yeah.
Oh, go ahead.
No, is that exactly that? Is that having larger social circles seems to be a major factor at the scale of cities that's protective. Now, this is not true of everybody in detail, but works at the level of entire cities.
Now, you say you looked at all kinds of different research for this. Tell me about some of the data that you analyzed to come to these conclusions.
Right. So mental health is hard to diagnose, but there are certain ways in which both the Center for Disease Control and other federal bureaus measure sort of the onset of depressive symptoms. And these are national surveys that have become big enough now to be organized in different cities. So we use that kind of data with somewhat traditional and sort of a gold standard, but then we used also a lot of Twitter data that's been analyzed more and more recently to judge sentiment. And so it's been shown in sort of some smaller studies that you can actually tell if somebody is expressing depressive symptoms with good confidence by analyzing how they're talking on Twitter. So we used both, and the results are consistent between all these different sources. And so this is what allows us to both have confidence in the results of the study, but also push them a little bit towards having larger populations.
Are there tangible public policy initiatives that you would recommend coming out of your findings in this study?
Well, so depression is a major issue in public health and has an enormous cost. There are many causes to depression. Often at the individual level, it's seen as a sign of aging or unemployment, other social stresses, segregation. But what our findings show is that there's a generic effect that greater socialization, even when it is somewhat superficial, as we have in a larger city, is protective. What we're trying to do now with better data and other colleagues is to look more specifically than inside cities, where we know that obviously different populations, for example, by socioeconomic status or by employment status, will have different challenges. And by doing that, we'll be able to target, more local populations where typically policy is being developed. For example, as we are doing in Chicago in relation to neighborhood.
So Luis, I guess what I want to know though is a lot of people do live in suburbs or small towns. So are there things that planners there can do to increase social interactions or the built environment to reduce depression?
Yeah, exactly. So some of the results that we are reporting include the suburbs in the sense that they belong to larger cities. But if you live in a suburb, in some sense, there's more isolation built in. So it requires that you're still connected to other people through commuting and other activities, but that those become more intentional. So that intentionality is important. And when it's lost, for example, through COVID, it has a lot of consequences for mental health, as we know, but we're finding out more. From the point of view of smaller towns and places in the country that are losing population, I think this gives us a bit of an alert that mental health is also expected to degrade, and that we should think about activities and places that bring people together, that create sort of the possibility of more sort of accidental and joyful, serendipitous social interaction, and that also may create, new sources of choice and purpose in people's lives. But this has to be done more intentionally in places where this doesn't happen more naturally, like in the public spaces of bigger cities.
All right, well, very interesting research, and our thanks to Luis Betancourt. Thank you so much.
My great pleasure. Thank you.